Question 1. A 68-year-old patient with left-sided heart failure reports difficulty breathing when lying flat. Which term best describes the symptom? A. Orthopnea. B. Dyspnea on exertion. C. Paroxysmal nocturnal dyspnea. D. Cheyne-Stokes respiration. Answer: A. Explanation: orthopnea is shortness of breath that occurs when lying flat, commonly seen in left-sided heart failure. Question 2. A patient with heart failure is prescribed furosemide. Which electrolyte imbalance should the nurse monitor closely? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hypernatremia. Answer: B. Explanation: furosemide, a loop diuretic, increases potassium excretion, so hypokalemia is the primary concern. Question 3. A nurse is caring for a patient with right-sided heart failure. Which assessment finding is expected? A. Crackles in the lungs. B. Ascites. C. Pink frothy sputum. D. Pulmonary edema. Answer: B. Explanation: right-sided heart failure causes systemic congestion, leading to ascites, hepatomegaly, and peripheral edema. Question 4. The nurse teaches a patient with chronic heart failure about fluid restriction. Which patient statement indicates correct understanding? A. I should limit fluids to about 2 liters per day. B. I can drink as much water as I want since it's healthy. C. I should avoid fluids completely. D. I should drink more fluids to help my kidneys. Answer: A. Explanation: patients with heart failure are typically advised to restrict fluid intake to around 2 liters per day to prevent fluid overload. Question 5. A patient with heart failure is receiving digoxin. Which finding requires immediate nursing action? A. Heart rate of 58 bpm. B. Nausea and vomiting. C. Blood pressure 128/78 mmHg. D. Serum potassium 4.0 milliequivalent/L. Answer: B. Explanation: nausea and vomiting may indicate digoxin toxicity, requiring prompt intervention. Question 6. A nurse assesses a patient with left-sided heart failure. Which finding is most concerning? A. Bilateral crackles in lung bases. B. 1+ pitting edema in ankles. C. Fatigue after minimal exertion. D. Nocturia. Answer: A. Explanation: crackles indicate pulmonary congestion, which may progress to pulmonary edema, making it the most concerning finding. Question 7. The nurse is evaluating teaching for a patient with heart failure prescribed ACE inhibitors. Which statement indicates a need for further teaching? A. I should rise slowly to avoid dizziness. B. I may develop a dry cough. C. I should stop the medication if I feel dizzy. D. I will have my kidney function checked regularly. Answer: C. Explanation: dizziness can occur due to hypotension, but the medication should not be stopped abruptly. The provider should be consulted first. Question 8. A patient with severe heart failure has jugular vein distension, crackles, and peripheral edema. Which priority nursing intervention should the nurse implement? A. Restrict fluid intake. B. Elevate legs on pillows. C. Administer prescribed diuretics. D. Encourage ambulation. Answer: C. Explanation: administering diuretics reduces fluid overload and is the priority intervention for decompensated heart failure. Question 9. Which dietary teaching is appropriate for a patient with heart failure? A. Increase sodium to maintain fluid balance. B. Limit sodium intake to less than 2 grams per day. C. Eat high-sodium canned soups for energy. D. Restrict potassium-rich foods. Answer: B. Explanation: sodium restriction to less than 2 grams per day helps reduce fluid retention and worsening of heart failure. Question 10. A patient with decompensated heart failure is receiving 4-furosemide. Which assessment finding indicates the medication is effective? A. Decreased peripheral edema. B. Increased jugular vein distension. C. Increased shortness of breath. D. Weight gain of 1 kilogram in 24 hours. Answer: A. Explanation: diuretics help remove excess fluid, leading to decreased edema, weight loss, and improved breathing.